Hey, everybody, it's David with Highway to Health podcast. Thank you for being here. We're glad to have you. You know, if you followed the podcast, you know I'm passionate about this open road journey that we're all on in the healthcare village to improve access to healthcare, experience during the healthcare journey, and then also the outcomes of our patients. And if you've been paying attention to the headlines like I know you have been, there's been a lot of consolidation in the healthcare space. And sometimes because of pressures in the market around margins, reimbursement, and cash flow, it's put a strain on the access that our patient community has to the care that they need. Today, I'm excited to talk with our guests about how those pressures are impacting the M&A activity that we're seeing in the healthcare, especially the provider space. And so today, I'm excited to host Andre Ulloa, who's a partner at M&A Healthcare Advisors, to talk about what we're seeing in the market and how that's affecting and impacting the patient community and the provider community. So Andre, thanks for being here. Welcome to Highway to Health.
Hey, David, how are you? Thanks for having me.
Man, I'm glad you're here. And I've really enjoyed getting to know you and the team over the past year and a half or so. And all the awesome stuff that you do. I've learned a lot from you guys, and I'm excited about this conversation. This has kind of become a tradition of mine. We'll get into healthcare in just a minute. This is kind of healthcare, I guess. I'm excited to learn from the executives that I have on the show about their healthy habits. You're as busy as they come, but we all have a responsibility to take care of ourselves. For the community that we serve, but also for our families. So if you don't mind me asking, what are some of the healthy habits that you've implemented in your life and your routine so that mentally, physically, you stay where you want to be?
Yeah, it's a great question. I mean, I'm under quite a bit of pressure, as you know, in the deal world. And, there's so many twists and turns, and we have to be ahead of the curve in process. And so I'll say that one of the most important things for me is that if I tap out, and I'm not working, I really do my best to just kind of put the phone away. And this might be contra to what other people consider to be relaxing and a healthy habit, but I spend a lot of time with my wife, and and she's really my closest friend, and she helps me to decompress. And she's started a pickleball league about a year and a half in now, and it's got hundreds of members. And she's funny. I mean, she could, I think, organize a Fortune 500 company better than she could do this league. I mean, it's so much logistics and moving parts, but it's she's doing that with a couple other folks, and I get involved in that with her. So that keeps me active and keeps the movement going. I'll say that, when I, speaking about when I, disengage from the work, it's really important for me to really not be in it, which is difficult, right? Because I might get client calls at, 11 o'clock at night and all that, and I'll take those, and, I have to be there for them. But one of the most important things for me is sleep too, and I mean, movement during the day at some point and sleep at night are so vital to me. And I grew up in a culture, of Cuban background where, Latins thought that sleep was for the weak. And so, a lot of it is, I'm not a great sleeper, but I can tell the difference when I get a good one versus a bad one. So anyway, I'd say those are two sort of areas of focus for me.
I think working hard, playing hard, and then sleeping hard is a pretty good balance. We might just title this podcast Pickleball Better, and we get a ton of engagement because that's the most popular sport in the world right now. And a little plug, if for anybody listening, we've got a member of the MarketScale community. His name's Johnny Quinn, former Olympian. He started a pickleball app. It's called Pickle Better. And so for anybody, especially for you and your wife and the community, the league that they're serving, look up Pickle Better, the mobile app.
Okay.
It's got a lot of a lot of cool tricks and things that you can do to get better at pickleball, but also stay healthy. And there's some good things in there. So
like the cross promotion there, David. That's good.
Yeah, a little plug for our friend over Johnny Quinn.
I will. Okay, just a quick story. I know because so many people are interested in pickleball. We went to Oklahoma City, and there's a place called Chicken and Pickle there.
Yeah.
Okay.
Yeah.
So I ended up going there. My wife loved it. We bought a whole bunch of merch, and then we had a tournament that we played in Vegas about 3 months later, and we were wearing all of our stuff. And the pickleball folks from the marketing folks from Chicken and Pickle saw us, and they came up to us. We had a conversation, and we ended up sponsoring. They ended up sponsoring us in Los Angeles.
Wow!
And so my wife and I and another guy that we play with, we get this box every 3 months. So you're talking to a sponsored athlete. I just want you to know that.
I'm not worthy.
So anyway, that's it's kind of a phenomenon. It's really taken over. But the one thing too, it's like in LA, we're really not that good relative to the rest of the country. There's some folks out there that can really play. So
yeah, and it's attracting all kinds of athletes. Athletes that have never really played anything before, all the way up to the former Olympians like Johnny Quinn that are playing, and it's a lot of fun, and it's fun to watch too. So I think it's a cool sport. But I appreciate you sharing those things with us.
Sure.
Well, next time we're in Dallas, we'll have to find a court. There's a Chicken Pickle here in Dallas that we might have to go to.
Yeah, so outside, it's a little outside, right? But because they need a lot of space, it's like the top golf of pickleball, right? So
yeah, it is kind of in the suburbs, but it's a nice place.
Right, we're plugging a lot of brands right now, man. I hope they recognize.
That's right. We're open to sponsorships. You're sponsoring Andre and his league. You can sponsor this podcast if you like.
My pickleball addiction.
Hey, we all have one. Well, man, I appreciate you sharing those things. It's personal to ask about your workout routine, but I appreciate you sharing. I think it inspires the people that are looking for ways to improve their health mentally and physically. So thanks for sharing that. Let's talk a little bit about what we came here for, which is the healthcare space in general. Let's set the stage for our listeners in some ways. We've seen some consolidation across across healthcare. M&A Healthcare Advisors is on the front lines of these conversations in a lot of ways. And so just, if you don't mind, start at a high level, set the stage. What are you seeing in terms of M&A activity across the healthcare landscape right now?
Well, so let's talk about M&A Healthcare Advisors to start that off. So it's kind of from the bottom up in a way. We're in the lower middle market, right? So the smaller healthcare providers. We're working with a lot of what we consider legacy type operators. So services businesses, right? We're not going to be that involved on the technology side, biotech side, pharma side, right? But in terms of if there's logistics, if there's patient care, we cover that, right? And so one of the things that has definitely happened, in the past, 7 years, let's call it, is there's a sophistication of representation of these smaller businesses, right? And a lot of that has to do with the fact that these smaller businesses are a target now for larger financial acquirers and strategic companies, whereas maybe they would have been too small before, but now there's such a focus on really more the caregivers and the market share of these businesses. And then, the patients are there. There's plenty of patient demand. But one of the things about us is that we've really tried to differentiate ourselves as an investment bank style advisor, where we're providing that sophisticated level service. Sometimes our clients don't know the difference, but the results are there in terms of getting us to the finish line. So I bring that up just to say that, yeah, the market has shifted. You've got more sophisticated sellers. And the reason that you need to have advisory in that regard is because the buyers are, employing very high standards for what they qualify as a business worth closing, right? Worth transacting. And so in our world, we're dealing with a lot of private equity, and we've dealt with that over the years. And we're dealing now with a lot of larger strategic companies. And so the real focus in healthcare, as I said earlier, is caregivers. Right now, there's just not enough skilled labor to handle the demand that's out there. And that's how we fit into it. Now, the iteration that we've seen in the last 3 years as a result of COVID has been that more people want to heal in home, and they want to move away from the clinics and the facilities and the hospitals, and the hospital incentives have increased for those businesses that keep the patient from returning to the hospital or those care settings. They're just more expensive, right? And then you and I will talk about payers later on, but the idea around the pay structures and all that is moving more towards that value-based modeling. And so it's really an effort to try to focus in on what's best for the patient. Unfortunately, there's so many layers in there where regulatory layers, the healthcare laws, the labor liabilities. There's so many layers in there that these transactions become very complicated. So, I think that kind of encapsulates where we are. The last thing I'll say is that, inflation, in some respects, it doesn't affect the transaction activity, but it does affect valuations. And when you start to see, this week, Fitch downgrades, the U.S. credit, and you see that cost of capital is, very high, that starts to affect people that are in the market that are buying based on a multiple of EBITDA, and their underwriting is and their debt is based on how those markets are flowing. So it gives an advantage to those who have cash flow on hand, and the free cash flow folks are the larger strategics. Now, they may not buy it for as much, but they're going to get a lot more cash at close, and the transaction may be easier. So those are things that are happening right now, and there's a lot of uncertainty about where the future is going. But I will say the activity is there.
I mean, it makes sense economically, right? You touched on supply and demand. The demand's there. The patient volumes are there. The need for healthcare, access to healthcare is there from the patient community. But the supply is down. I mean, we're seeing, I had a conversation last week about the nursing shortages and how, by 2027, we're expecting almost 750,000 nurses to exit practice. And then I had a conversation yesterday about how even physicians and healthcare professionals there's a gap there. And so it's interesting to me to see how that affects the M&A activity and how investors are valuating a transaction, how they're strategically identifying an opportunity.
Yeah, I mean, you're in a scenario where you're in a scenario where you're just not attracting the labor that you need. And yeah. I mean, honestly, like if you think about your physician, right? I mean, outpatient care is probably most people's how most people interact with healthcare, right? I mean, a physician that's in an HMO or PPO plan, some kind of in-network structure, I mean, it's really a cattle call for that physician, right? I mean, they gotta churn and burn on these things. I mean, it really kind of takes away from what their mission was, when they started this, right? It was, it was kind of like, I mean, obviously it's always do no harm, but it's also the idea that, you're looking out for your patients, right? And you had that family doctor when we were growing up, and,
Yeah.
and that was the guy you went to, and he knew you, and he knew everyone in your family, and that's who you went to. And now it's difficult to maintain those types of relationships. And I'll say that I'm a big believer in the private equity model, which may not be what a lot of my people that have sold or sellers believe in. But I think that it makes sense to me that you have that. I mean, there's some level of consolidation, that there's some, that there's a portfolio style company, but then there's other companies within the mix that can sort of self-manage and and handle themselves. And I think what a lot of these health systems did was they vertically integrated way too many pieces. And so we're seeing a lot of folks spinning off, but they're spinning off certain aspects of their healthcare. But what they
Right.
really are trying to do is maintain a culture for the caregivers so that they can be retained, right? So they don't have attrition there. And that's the focus right now. So I mean, that's a scary statistic. I mean, thinking about 2027, what are we doing? What are we doing to attract them? Because I'll tell you, tapering on these reimbursements, that's not helping much, right? So you're like,
Yeah.
I'm going to work more and not get paid more, or potentially get paid less. And it's not all about the payments. It's also about the culture, as we see, with a lot of our operators, who are smaller and more nimble, and can keep these crews of people excited about the work they do. But still, at the end of the day, they got to make ends meet, and these reimbursements keep kind of tapering a bit. And it's like everyone's looking at it and going, "Hey, well, the insurance companies are getting a lot wealthier, but but what's that doing to really get folks into the market, both on the service side of it and on the patient side of it?"
Yeah, you're touching on one of the biggest topics in healthcare right now, which is the reimbursement challenges that most of these providers and facilities are facing. I live out in the country. If I were living in closer to downtown Dallas, I'd have a lot more options, right? The kind of facility provider that I went to go see, this challenge with reimbursement right now and margins is hitting these rural facilities probably the hardest, which limits access to patients like my family. And when it's limited in terms of access, that hurts the experience, because you're probably going to a provider, a healthcare professional that is seeing more patients per day than somebody living in a town like downtown Dallas, because there's just fewer facilities. It's just math, which then may discourage me or my family from going to the doctor as often as I need to, which then affects the outcomes. It's such a domino or snowball effect here in this space that something has to be done. And I think there are steps being taken to fill that gap. But I want to talk about the reimbursement model with you, because I think the reimbursement challenges and the margin challenges that most facilities are facing now is probably impacting the investor community. So how have those challenges, not just the trend towards value-based care, but also just the squeeze that's happening on fee structures and reimbursement structures, from Medicare, Medicaid populations going up, these commercial payers basing their structures off of those government payers. How is that impacting the investors' strategy when valuating a practice that they might be looking to transact upon?
Yeah. So what we were talking about was more the operators, right? And how they're getting adversely affected by these structures. I'll say, from the standpoint of, M&A and being an intermediary, we deal with a constant uncertainty around reimbursement. right? And we're told that CMS is considering initiatives that will greatly cut Medicaid, for instance.
Right.
We've ultimately found that CMS does the right thing. Sometimes they're not good about messaging, but I will say that through COVID, we gained a lot of confidence that CMS was going to do the right thing. And as evidenced by a lot of stimulus monies and programs where folks were definitely cash neutral and able to operate their businesses in the face of that huge catastrophe that was COVID. So I think there's always a sense from us and how we advise our clients is that, look, CMS might make a change, they might make some adjustments here and there, but it's not going to be, it shouldn't be at such a level that it greatly affects your valuation on your business. Right now, it might be troublesome in terms of your ongoing, recurring reimbursement and all that, and maybe it's a prompt for you to look better into your your QA and how you're billing and your case mix and things like that. But ultimately, from a transaction standpoint, we've dealt with so many financial buyers who have done extensive quality of earnings analysis, clinical analysis. They get in there. I mean, our due diligence periods have increased 100%. I mean, I'd say we're probably in due diligence no less than 5 months now when we're dealing with a financial firm, and so they go through that, and it's very rare that they use a proposed reimbursement structure or something that's happened while we're in process as a reason for renegotiating or adjusting the value of the business. So I will say we don't think it has a nominal effect from an M&A perspective, but on a long enough timeline, it's gonna hurt the operations, and then obviously that's going to create downward pressure on valuations.
Yeah. Well, that's actually encouraging, because you're right about CMS making the right choice, especially during COVID. I mean, the programs like telehealth and virtual health that they increased and improved the reimbursement models so that, these providers could open up some capacity was really helpful. Yeah. And here we are in 2023, the back half of the year, almost a year and a half removed of real COVID heights, and those reimbursement models are still in place, thankfully. And so, it is good to see that positive trend, especially with the CMS and the payment structures that are so prevalent now in the healthcare space.
Yeah, David, another thing I'll say too is that it looks like CMS acts somewhat independently and does have a mission in terms of the patient, right? Because there's a lot of incentives for making sure that the patient gets healthy. There's a lot of incentives. Let's make sure this patient doesn't go back into the hospital, right? Like that there's incentives there. There's also the idea that from CMS you get this you get this focus on what's better for the patient. Right. So you think about situations like the regulations around what was homebound before COVID relative to where we are now. And that's loosened quite a bit. Right. It used to be like, if you can make it to the clinic, you're going to the clinic. Right. Now it's like, hey, look, I'm healthier. I'm safer in the home. I feel better here. Can I set up the services to be treated in the home? And there's a lot more pathways to do that than there were previously. I think that's one of the bright spots of COVID. It just realized that the facilities are not the best place to care for patients.
It's it's been great to see some of the non-traditional service, locations of services pop up, not even just at home. It's these more outpatient style facilities that, put less of a burden on the patient and the provider, both in time, commitment, obligation. It's almost like you can get in and out faster, even when that service isn't being rendered in the home. It's being rendered at more of an outpatient facility or almost like a retail facility, because you got to pop in and pop out with how busy everybody is. And some of the things that have happened over the last few years, and COVID was a big propellant of this, or a big accelerator of this trend. It's made it easier to access the care that you need when you need it.
Yeah. There's a program where family members can be paid through Medicaid dollars for helping their parents at home, and those programs have increased tremendously too. I mean, and it just makes sense, right? I mean, that's the person that is most caring towards you, right? And if they're sacrificing their careers, or there should be some stipend for them. It's not a lot. It's not a lot. It could be more, and I think this health system would benefit from more payments in that regard. But it's there, and it's a program that continues to flourish. Now, there's rumblings of that there's going to be a great reduction in that reimbursement for the providers and all that. Well, for us, it's a lot of talk. It's a lot of noise until it actually is true. That's kind of our philosophy in a transaction anyway, right? It's like, until I see it in writing, or, it's never a done deal until it closes. Like that's our philosophy. So.
Well, you said that M&A Healthcare Advisors, focuses more on the lower to mid market. Tell us a little bit about, the companies, the providers, the facilities that, M&A Healthcare Advisors really specializes in.
Yeah. So, we do quite a few home health and hospice transactions. We have done outpatient care, physician groups. We have worked with pharmacies extensively. That was really an area that I was focusing in on. So, if you want to rank it in terms of, where the bright spots continue to exist, definitely in behavioral health. The autism side of it, all the way through the IDD part of it, all the way through the treatment centers. I mean, obviously, again, it's not a great thing, but when economies are uncertain, and when we have as much volatility as we've had in recent years, the treatment of behavioral health becomes much more important. It's a lot of mental health things going on in this country we're still trying to figure out. So that's a big area where we continue to see growth. Hospice is an area where the multiples have stayed fixed to their record numbers from a few years ago, and we're seeing that there's just a tremendous amount of interest in staffing companies as well. That's another area. You touched on that a little bit, but yeah, the idea that you need to cover on this patient care, and so staffing companies have improved there. There's been a lot of consolidation in areas, I guess, kind of a step below that in terms of where things have slowed a bit, but still maintained. There was a lot of dental service organizations that was consolidated. It was a way for the financial firms to go in there and buy dental practices. There was a lot of movement there and tremendous consolidation, but there's still now a lot of acquisitions going on in that market. And then areas that we see some future potential, things like, we'll probably touch on this, but cash payer type businesses. We're seeing a lot of concierge style medicine happening right now. And, folks are using their Medicare dollars and then subsidizing it with their own cash to increase and heighten the level of care. So things like med spa are doing are something where we see some growth potentially. One area that is a little off the beaten path is home home care support equipment and technologies, things like that that usually are not paid for by CMS, but are something that can be included in the home so that there's equipment there to support mobility within the house. That's an area where we're seeing some growth, and then the service providers for that equipment. That's an area where we might see some consolidation. And I'll say one other area is clinical research organizations. A lot of these companies are outsourcing clinical research now to folks that are able to do it faster and more effectively, and we're seeing a rise in that area too. So I kind of give you the spectrum of what's been true and solid segments of the market, what those areas that are sort of maintaining, and then the areas that are ripe for growth. I'll say, unfortunately, I wish I had better news about pharmacy, but right now there's some legislation in play, but right now pharmacy is struggling right now. There's the fact that a lot of the larger companies that are in pharmacy, I mean, there's Consolidated, 80% of the market's owned by 5 pharmacies, and
Right.
they have PBMs attached to them, and so they kind of can control the flow of money. And that 20%, the providers that we might represent, those folks are finding it's a lot of logistics. It's very difficult to grow. It's very difficult to make a margin, and so it's just not as interesting. Infusion pharmacy is one bright spot for sure, but those valuations we used to see on long-term care pharmacy and the valuations we used to see even in specialty pharmacy and retail pharmacy, those things have dropped significantly.
Tell us, how did you get here? I mean, how did this become your vision and your mission? Tell us a little bit about your background.
Yeah, so I was actually in hospitality. I was in the food and beverage world. I owned restaurants, and I was just always passionate about providing service. And then I realized that that world was not sustainable in terms of having a family, and I ended up making a big change. This was about 12 years ago now. As a result of I got very sick. I was actually an ultra marathon runner, and I got really sick with a pneumonia. It almost killed me, and
Wow.
yeah, and I kind of snapped out of it, and I realized, we're not, there's too many pressures on me. There's too much going on. I just said, there's got to be another way, and I floated around. I tried to find, what was out there, and fortunately through my church, I found an investment banker who was just a solid guy, and he really became a mentor to me. And so, I went in as an intern. I was in my, early 30s, and I just started over again. And, I had 2 young kids in tow, and I just said, let's do this. And I realized very quickly that this was work that I could really do well in. But I was a little late in the game. And so I figured a specialization was really important. So I really cared about people and about taking care of people. So I figured healthcare was a great place to go. It's also obviously an amazing market to be in. And I ended up going in that direction. So that was about 10 years ago now. And then, we started the firm about 2 years ago. And that was a result of me finding a partner who, ironically, my partner, Mike Moran, was also in restaurants for years. So, the great thing about that and cutting our teeth in that business was that, we know the definition of work and what a grind is. And like that does not scare us at all. and we've also know how to interact with everyone from every walk of life. I mean, we were dealing with busboys, we were dealing with CEOs, right? And and so from that standpoint, we have a tremendous amount of respect for anyone that puts the work in, but we know that the only way to get to the finish line is putting one foot in front of the other and grinding.
A couple things stick out to me. I mean, first of all, almost everybody I talk to that is in healthcare today had a healthcare experience of their own that motivated them, or at least inspired them to be interested in the healthcare industry overall. And that's similar to you. The other thing is, similar to myself, we have some similar characteristics. I was in coaching and working all hours, driving unbelievable miles to recruit, and I was speaking to players, coaches, parents, school administrators, and so I had to learn how to speak at different levels of influence and build relationships at different levels of influence. Sounds like you had the same experience in terms of workload and exposure in the restaurant and hospitality industry, which, as we know in healthcare, that really pays off. And so I love hearing the background of folks that are in healthcare now and making a difference, because oftentimes it includes those things. Being able to build relationships no matter the level of influence, and also being willing to work through all kinds of challenges and just one foot in front of another until you get the job done. And so that's what healthcare needs more of. And if anybody's listening that has those experiences and may not even be considering healthcare at the moment, I think, Andre, you and I would encourage them, because healthcare needs people like that. There's plenty of challenges, and there's plenty of communities that need help. And based on your experiences and your willingness to work, you might be a great fit in the healthcare space.
Yeah, given your listeners, the fact is that there's so much fulfillment that happens. Unfortunately, we're dealing a lot with operators who are at their wits' end in many ways, but they have to also, we have to get them into focus that what they've done over the life of their business is they've really helped people. And we've got so many just solid people that we deal with, and from all parts of the country, right? And they have dedicated their lives. They created a business. Look, I'm sure there was a financial expectation and there were aspects of that, but at the end of the day, when they got into healthcare to help people, and they have, and a lot of times that gets lost in the management of reimbursement and the QA and the dealing with the HR aspects of the business. But I would encourage them to continue to put the shoulder against the wheel, make it happen, and realize that that there's the fulfillment is there both spiritually but also financially. I mean, there's for someone that has a business that's in healthcare that's focused on their people, focused on the people just across the board, whether it be patients, caregivers, management, those folks are going to be successful, and they're going to have value in what they do, when they decide to exit. So I think that's a good one to do.
Well said.
Yeah.
No margin, no mission. And so they go hand in hand. We talked about it in the introduction. This show is, to articulate and celebrate this journey that we're on. Access, experience, outcomes for patients and providers. There's a lot of good work that's being done to improve all three of those things. And sometimes, if you are a provider, you need a partner like M&A Healthcare Advisors to bring the resources, make those connections so that your mission is executed on. And so, Andre, thank you for all the work that you and your team do for the healthcare community. I appreciate you being on the show.
David, really appreciate it. And thank you very much for having us and for all the great work you do, really shining a light on some of the most important people and practices and operations in the country. So thank you, my friend.
Hey, good luck to y'all.
All right, my man. Take care.